compact coming up for another discipline. This started off as a project of the Defense Department and the Council of State Governments to make licensure across state lines easier. This bill is similar to other 6 licensing boards that have compacts: audiology, speech-language pathology, counseling, nursing, occupational therapy, psychology, and physical therapy. So those are already in existence. The difference between this one that we might have heard a few years ago, the compact is currently operating. There's 22 states that are member states of the compact currently. This does not take away the ability of North Carolina to regulate the practice. This just simply allows us to have a consolidated way for licensed social workers to get an easier license between different states. I'm happy to answer any questions or go into details, but would ask for your favorable support.
Okay, any questions? Representative, you're for a motion at the appropriate time.
Yes, sir. I ask for a favorable report to House Bill 231. If favorable, refer to Finance. If favorable, refer to Rules. Thank you, Mr. Chair.
All right, let's put that on hold a moment. I believe we have 2 people signed up to speak.
As amended, I'm sorry.
That's fine. Valerie, Arendt.
Thank you, Mr. Chair, and thank you, committee. My name is Valerie Arendt. Aren't you glad to be in House Health today? I'm the Executive Director of the National Association of Social Workers North Carolina chapter, and I thank you all so much for taking up House Bill 231, the Social Work Interstate Licensure Compact. Social workers are the largest provider of behavioral health services in North Carolina and across the nation. However, North Carolina is contending with a shortage of mental health providers, and an interstate compact will allow for practice mobility and remove barriers from preventing social workers from providing continuity of care. The compact will ensure the licensees abide by regulations and rules that govern the practice of social work in North Carolina. The compact will modernize data sharing between states, which optimizes public protections for vulnerable clients. In 2021, the Department of Defense, as part of an initiative to promote license portability for military spouses, funded an initiative to establish this legislation for multi-state social work licensing. The compact will make it easier for North Carolinians to receive mental health support they need during times of disaster. The mental health needs of those impacted by Hurricane Helene are significant and will be there for the long term. Our social work members in Western Carolina had clients evacuate to Tennessee, Virginia, and Georgia and other states, and were not legally able to continue to provide care via telehealth unless they secured a license in those other states, ending any continuity of care to address the trauma of losing their homes, their community, and their loved ones. The Social Work Licensure Compact is a long-term solution to the issue of licensure portability. I thank you so much for considering this and ask for your support.
Thank you, ma'am. Elizabeth Pope.
Good morning. I'm Elizabeth Pope. I serve as Executive Director for the North Carolina Social Work Certification and Licensure Board. Thank you for having us and hearing this bill. I wanted to make myself available for any questions that you all may have regarding this bill. But overall, the board's mission is to protect the public and the citizens of North Carolina. And I wanted to reassure you that this licensure compact would do just that. It will help us continue with that mission. The data system that's being established will help us notify and understand who will be practicing in the state. If there are any concerns, we may restrict licensure to those individuals, and so it will help us further protect the citizens of North Carolina who are receiving those social work services that are so greatly needed. Thank you.
Thank you, ma'am. Any comments? I have a motion by Representative Cunningham for a favorable report to House Bill 231 as amended, unfavorable to the original, rolled in a new PCS with a referral to Finance. I believe that's what I heard you say, wasn't it? I thought it was. My LA has better hearing than I do, but she told me that was it. Thank you, Ms. Representative Cunningham. All in favor of the motion, aye? Aye. Any opposed? Thank you. Zarek, you want me to adjourn? The meeting is adjourned. Dr. Reeder was busy.